Good afternoon. My name is Diane Varga. I'm with Family Partners of Morris and Sussex Counties, and I welcome you to this week's Lunch and Learn. Today is October 10th, 2024. Our presenter today is Yoreni Syme with the Partnership for Maternal and Child Health of Northern New Jersey, and she will talk today on the topic of adult immunizations. Welcome.
Thank you so much, Diane. So my name is Yoreni, and I am the Immunization Initiatives Program Manager for the Immunization Initiatives Program at the Partnership. And so today's topic will be Let's Immunize, a guide to adult immunizations. And I also would just like to quickly share that this program, this specific slide deck was created by my colleague, Jasmine Anderson, who is the specialist under this program as well. So the slides that you'll see has been provided by her, and today I will just be presenting it for everyone. But first and foremost, before moving forward to immediately talking about immunizations, I do have to share a quick disclaimer that shares that this activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. Now, what are the objectives of this program? Participants, after watching this recording and participating in this program, will be able to explain what vaccines are and how they work. They're going to be able to discuss the recommended immunizations for adults ages 18 and older, as well as summarize adult vaccine preventable diseases. First, we're going to go into the overview of what vaccines are, how they work, and why adults should be vaccinated. So, what are vaccines? Vaccines are safe, simple, and effective tools that protect us from pathogens before we encounter them. Pathogens are viruses like the flu or COVID-19, or bacteria like tetanus and meningitis that can cause disease. So, two different pathogens that we protect ourselves from with vaccines. How do vaccines work? The following video explains exactly how vaccines get the job done.
We're constantly surrounded by disease-causing organisms. Whether bacterium, virus, parasite, or fungus, germs or pathogens are made of several subparts, which are unique to that organism and the specific disease it causes. When a new pathogen enters your body, it introduces something called an antigen that causes the immune system to form antibodies, your body's tools for identifying and targeting the invader. For every new pathogen and its antigens that your body sees, the body needs to build specific antibodies. It takes time for the immune system to respond and produce the exact antibodies needed to fight back. In the meantime, the person is susceptible to illness. It's a race between the invader and the host. Here's where vaccines help. A vaccine is a substance that is designed to mimic a pathogen and its antigens. The vaccine isn't infectious by itself, but its job is to teach the body to build a specific antibody. When you then encounter the real pathogen later, your body already has the formula for the antibodies it needs to defeat it. Vaccines are made in several different ways. Many vaccines, like the measles vaccine, contain parts of the pathogen, while other vaccines contain a version of the germ that has been killed. However, newer vaccines, such as the Pfizer and Moderna vaccines against COVID, don't contain any part of the virus at all, but instead contain a blueprint for producing antigens. No matter the type of vaccine, after getting vaccinated, you develop immunity to that disease without having to suffer from it first. Vaccines are given individually, but when most members of a community are vaccinated, everyone is protected, even those who can't be vaccinated due to underlying health conditions.
So we thought that this video would be cute to share as opposed to me just explaining all of these things, and it has cute little graphics. So I hope that that was helpful. And why should adults get vaccinated? Well, first from that previous video, we learned that it is to boost protection. So protection from vaccines you received as a child begin to wear off as you become an adult. So there are some vaccines that we need to get a sort of boost or another dose of. Adults are at risk for different diseases, and vaccines are based on certain conditions, and these conditions include risk, any health-related illness or condition, age, the job that the adult may work at can put them at risk for certain diseases, the lifestyle or travel habits. Of course, when we travel, we are exposing ourselves to new germs, and these are the reasons as to why adults should be vaccinated. Now, what are some adult vaccines? You can see them on the screen. We are going to go to dive deep into vaccines that are recommended for adolescents, well, for adults, and the diseases that they protect against. Many of these actually adolescents can also receive, but there are some that are more important for adults to receive, especially older folks who are more at risk because of their age. So let's start off with the flu. So seasonal influenza is an upper respiratory virus that infects the nose through uh, throat and lungs. Symptoms include fever, muscle pain, sore throat, cough, and extreme fatigue. Flu spreads through the air and direct contact. Risks include pneumonia, bronchitis, sinus infections, ear infections, and even death. A common misconception about the flu is that it is not a serious illness. However, that is not true. It is especially serious for children and babies. Children can develop serious complications from the flu. They can be hospitalized, and the flu can even be fatal for children. There have been 126 pediatric flu deaths, and I know that number has increased as of late. 88% of those children being unvaccinated and ranging from ages younger than 6 months to 17 years old. It is recommended that everyone, including adolescents, receive one flu shot annually by the end of October. Flu viruses are constantly changing, and the flu vaccines are reviewed and updated each year based on the most frequently circulating flu strains from the previous flu season. So that is one thing that a lot of people ask about is why do we need to vaccinate every year for the flu? And that is because every year there is a different strain that is most prominent. And so it is important to be vaxxed against the strain that, can be circulating during flu season that year. The strain that can be circulating this year is not the same one as last year, which is why we need to get a new flu shot. Now, COVID-19, we have learned that it is a disease caused by the SARS-CoV-2 virus, which causes mild to severe respiratory illness. Symptoms can include the ones here. So, first, there may be no symptoms, but they can include fever, muscle aches, sore throat, dry cough, headache, nasal congestion, fatigue, runny nose, diarrhea, vomiting, new loss of taste or smell, and a loss of appetite. And as mentioned, it can also cause no symptoms. So COVID spreads through the air and direct contact. It can linger in the air for a long period of time. What are the risks? They include pneumonia, blood clots, liver, heart, or kidney damage, long COVID is where you experience many of the symptoms that I just mentioned for a very long time, and death as well. So it is recommended that all adults and adolescents receive one dose of the updated 23-24 Pfizer or Moderna vaccine, unless, regardless if they were previously vaccinated against COVID or not, and 1 to 2 doses of the updated Novavax vaccine. For adults who were previously vaccinated, they can get Pfizer, Moderna, or Novavax, regardless of what they were previously vaccinated with. So now moving on to diphtheria, pertussis, and tetanus. So diphtheria is a toxin from a bacterium that makes it difficult to breathe and swallow. It attacks the heart, kidneys, and nerves. Symptoms include sore throat, mild fever, weakness, and swollen neck glands. Diphtheria spreads through the air and direct contact, and the risks of diphtheria include the swelling of the heart muscle, heart failure, coma, paralysis, and death. Diphtheria used to be a very serious issue in the United States. In the 1920s, 100 to 200,000 cases of diphtheria occurred every year, with 13 to 15,000 deaths occurring every year. Pertussis, also known as whooping cough, is a bacteria that causes violent coughing fits. Symptoms include severe cough, runny nose, and apnea. And it can spread through the air and direct contact. So risk of pertussis are pneumonia and death. And last but not least, tetanus is a toxin from a bacterium that lives in the soil and causes lockjaw. Tetanus is the only natural occurring vaccine preventable disease and does not spread from person to person. It actually occurs when tetanus enters the body through wounds, cuts, and burns. Symptoms include stiffness in the neck and abdominal muscles, difficulty swallowing, muscle spasms, fever. Risk of tetanus includes broken bones, difficulty breathing, and death. So as you can see up on the screen, it is recommended that adults who have not been vaccinated receive 3 doses of Tdap, which protects against all 3 diseases. Every adult needs the booster every year of Tdap, which protects against tetanus and diphtheria. Every pregnant person should receive a Tdap dose for every pregnancy to provide babies with early protection, and 1 dose of Tdap for any dirty wounds. Or sorry, I said every year, but it's actually every 10 years. Adults need a booster every 10 years for Tdap. Moving forward. So as you can see here, there are different vaccines that need to be taken at different ages, right? So all this information can also be found on the CDC. And depending on the age range, children will either need DTaP or Tdap. Pregnant women will need DTaP, and so will adults and older adults as well. I'm just leaving up there just another second so that folks can see what ages are needed for, or what vaccines are needed for each disease. All right, moving on to RSV, which is a really, important one that is going around for the last couple of cold seasons and flu seasons. So RSV, or respiratory syncytial virus, is a common respiratory virus that causes mild cold-like issues and symptoms. So in other words, RSV is a cold virus. Anyone can catch and spread RSV, but it is particularly dangerous for babies, adults with certain medical conditions, and older adults that are 60 and over. Adults with certain medical conditions would include those with chronic heart or lung disease, weakened immune systems, and adults in nursing homes or long-term care facilities. So as you can see here, pneumonia, inflammation of the small airways in the lungs. And RSV is extremely contagious. It can spread through respiratory droplets from coughing, sneezing, or even kissing from an infected person. It can also spread from touching surfaces contaminated with the virus. And because the virus can live on hard surfaces for hours, and then, eventually touching the eyes, nose, and mouth can transmit RSV. Each year, it is estimated that between 60 to 160,000 older adults in the United States are hospitalized, and 6 to 10,000 die due to an RSV infection. Older adults with certain medical conditions should discuss with their doctors whether they should receive the RSV vaccine. For children, pregnant parents who are 30 to 36 weeks pregnant during the September to January season months can get the maternal RSV vaccine to protect their babies in the first few months of life. Moving on to hepatitis B and HPV. So hepatitis B is a vaccine preventable liver infection caused by HBV. HPV is transmitted when blood, semen, or another bodily fluid from a person infected with the virus enters the body of someone who is uninfected. Hep B can range from mild, short-term acute illness lasting a few weeks to a serious long-term chronic infection. In 2022, 52% of all acute Hep B cases were people ages 40 to 59 years of age. Rates of Hep B were highest among non-Hispanic Black people, and the CDC estimates that 640,000 adults in the US have chronic long-term Hep B. In 2022, the highest rate of chronic Hep B was in non-Hispanic Asian and Pacific Islander people. Many people infected with Hep B viruses won't experience symptoms, and if symptoms occur during acute infection, they often begin 90 days after exposure. Although the symptoms of acute HBV infection and chronic HBV infection may be similar, most people with chronic infection do not have symptoms until much later on in life, often decades after exposure. And the CDC recommends all infants, children, adolescents, and adults ages 18 through 59, and older adults who are at higher risk for Hep B, 60 plus, to get vaccinated against Hep B. Now, this is not to be confused with HPV. HPV stands for human papillomavirus. HPV is the most common sexually transmitted infection. 9 out of 10 people will be exposed to HPV at some point in their life. And although for most of us, it'll also clear out of our own system. But most new cases of HPV are made up of adolescents and young adults. So why is HPV so dangerous? It can cause 6 different types of cancers, and they include cervical, penile, anal, vaginal, oropharyngeal, and vulvar cancers. It also can cause genital warts, which can grow in different parts of the body, especially in the genital area and in the mouth and throat area. So, what are the symptoms? This is one of the tricky ones, in which there are no symptoms, so it can be transmitted unknowingly. There is no test to find out a person's HPV status. Many people find out from HPV through an abnormal pap smear when they get, genital or oral warts or after the cancer develops, unfortunately. HPV is transmitted through any kind of intimate contact, which includes vaginal, anal and oral sex, genital to genital contact, and even just intimate touching. So the risk of HPV infection includes the cancers that I mentioned, but it is recommended that everyone between the ages of 9 and 45 receive the HPV vaccine. And it is done in 3 doses. So if a child between the ages of 9 to 14 begin getting their vaccine series, they will only need 2, and then they'll be done for the rest of their life. But if an adolescent begins after their 15th birthday, they're going to need a total of 3 vaccines, spaced out between 6 to 12 months, and they'll be set for life. Once you are complete with the vaccine series, whether you're getting the 2 or the 3, according to the age that you began getting this vaccine, you will no longer need any more vaccines ever again. There is no booster required or needed. So the HPV vaccine is a cancer prevention tool. It protects against the 9 HPV types of cancer that cause cancer and genital/oral warts. It is over 90% effective in preventing these HPV-related cancers and warts. So again, the vaccines for these 2, for both Hep B and HPV, these are the only 2 that can prevent against cancers. Moving forward to talk a little bit about measles, mumps, and rubella. So they actually share very similar symptoms, and they spread the same way. So I'm just going to quickly talk about what what they are, right? So measles is a contagious viral infection that causes high fever, cough, red eyes, runny nose, and rash. And those at highest risk for complications for measles are children younger than 5, and adults are older than 20 years old, pregnant people, and people with weakened immune systems. Mumps is also a contagious viral infection that causes puffy cheeks and swollen jaws. And then rubella is also known as German measles. It is a viral infection that causes low-grade fever, sore throat, and rash. So from what you can see here on the screen, very similar symptoms for the three. So, rash, high fever, cough, runny nose, pink eye. Um, Over here, muscle aches, tiredness, loss of appetite, and same thing with rubella. So rash, swollen glands, fever, headache, tiredness, and muscle pain. So what can these three lead to? So they can lead to encephalitis, fever, pink eye, pneumonia, premature death, low birth weight, and death. Same thing for mumps, meningitis, encephalitis, swollen salivary and parotid glands, miscarriage during pregnancy, inflammation of testicles or ovaries, deafness, and death. And also, rubella is very serious in pregnant people, so it can lead to miscarriage, stillbirth, premature delivery, and birth defects. What are the vaccine recommendations? So, vaccine recommendations is 1 to 2 doses of the MMR vaccine. And for those adults who did not receive the MMR vaccine as children, and were born after 1957, it is recommended that they receive the 1 to 2 doses. Most adults just need 1 dose, but a second dose may be needed for certain adults if they are at high risk, like they work in a healthcare setting, for example, or attending, um, you know, university or post-secondary school. Moving on to chickenpox and shingles. Um, We know that chickenpox is a contagious viral infection that causes fever, headache, and an itchy, blistering rash. It is spread through air and direct contact. And the risks for chickenpox include infective sores, brain swelling, pneumonia, and death. The vaccine recommendations are 2 doses for chickenpox, and then for shingles, which is caused by the chickenpox virus, which later hides in the body and sometimes reactivates later in life. The symptoms include fever, um, and the risks include severe blistering rash on one side of the face or body, long-term nerve pain, and hearing damage, blindness, and death. The vaccine recommendations are also 2 doses of the shingles vaccine. And then this is the last slide explaining the diseases. So apologies on terms of the monkeypox. But in terms of pneumococcal disease, bacterial infection, it is a bacterial infection that can cause ear, lung, blood, and brain infection. So the types include pneumococcal pneumonia, and pneumococcal meningitis. The symptoms include, well, it depends on the body, the part of the body, but there can be no symptoms, but they can also include pneumonia symptoms, meningitis symptoms, and it can be spread through direct or air, direct contact or air. And then the risks to um, pneumococcal disease include uh, bacteremia. And I'm sorry if I'm butchering these words. Some of these are a little difficult, but and sepsis, meningitis. Antibiotics don't always work when it comes to these, when it comes to pneumococcal disease, and also death. So in terms of monkeypox, this is relatively new. So monkeypox is well, we're hearing about monkeypox later, most recently. So it is an infectious viral disease that can occur in humans and other animals. So symptoms include rash that forms blisters and then crust over, fever, and swollen lymph nodes. The illness is usually mild, and most infected individuals recover within a few weeks of treatment. So what are the symptoms? They include rash, fever, exhaustion, swollen lymph nodes, muscle aches, sore throat. And the recommendations are the medications include tecovirimat, and antivirals. So how can we prevent it? So the smallpox and mpox vaccine, hand washing, covering the rashes, and social distancing. Now, what to expect when getting a vaccine is we're going to talk about the common side effects, vaccine ingredients, combination vaccines, immunization records, um, and the Vaccines for Children program, which provides vaccines at no cost for eligible children. What are some common side effects of getting a vaccine in general, right? So any vaccine can give side effects and will vary depending on the vaccine given. The side effects on this slide were found to be the most common in adults. So most side effects from vaccines are mild and will resolve within 2 to 5 days. The side effects usually occur within 12 hours of being vaccinated, but some serious reactions to vaccines are rare. You should contact the healthcare provider if you are exhibiting any symptoms that concern you. So the most common ones are soreness, redness, and or swelling at the injection site, muscle aches, low-grade fever. But there we can experience some similar common cold-like symptoms. The vaccine ingredients serve a purpose, right? They are to provide immunity, to keep the vaccine safe and long-lasting, and to make the vaccine more effective. Where to get vaccines? We can get vaccines at the doctor's office. We can get them at the pharmacy, including retail pharmacies such as Walgreens or CVS. Local health department, which is best for uninsured or underinsured folks. The public health clinic. So there are some public health offices that we can look up online. You could just look up public health clinic and find the nearest one from your home. And this is best for uninsured and underinsured folks. And then federally qualified health centers, which is also another good option for uninsured or underinsured folks. So because these vaccines are recommended vaccines by the Advisory Committee on Immunization Practices, these vaccines that I mentioned prior are covered by most insurance companies. For those who are uninsured or your insurance doesn't cover at all, you can visit the local health department, the public health clinic as seen on screen, or FQHCs. Now, if you would like to keep track of your immunization records, and it is especially important if you don't have those physical records on paper, you can actually keep track of them through this application called Docket, and it can be downloaded onto your phone if you have either a Samsung or an iPhone. It works with Apple, and it also works with Android. So you can actually put in your information. I believe it'll ask you for your name, date of birth, potentially social security number, and you can actually see what the vaccines is that you've received and the dates. And so it's great for school, colleges, childcare, extracurricular activities, traveling. And it's also great for children when children are in school and they become an adult and need their records. So so this is a great way to maintain and keep keep safe your own copies and your child's copies. And you can also ask your child's doctor how they can keep vaccination records. So you can also ask them to enter all of your records and your child's records to the New Jersey official immunization information system. Doing so makes your child's records or your records even more accessible. And this docket is an easy way to access the immunization records from your phone. Now, there is a lot of misinformation and disinformation out there, so be sure that you're getting information from trusted sources. Here is a list of trusted sources whose websites you can visit to get more in-depth information. And a lot of the graphics that were shown in this presentation were actually from these trusted sources. So the American Academy of Pediatrics, the CDC, the Children's Hospital of Philadelphia, healthychildren.org, historyofvaccines.org, the National Foundation of Infectious Diseases, and vaccineinformation.org. So these are the most trusted sources out there where you can get the most accurate information. Please make sure that if you are going on to Google, that it is taking you to these sites for you to be able to receive the most up-to-date vaccine information. So they're always releasing, new information in terms of like what are the newest updates and when people should get vaccinated, or if there is a booster that's come out, or if there is a new vaccine that's come out for a particular disease. These sites will have the most accurate and up-to-date information. And that pretty much ends the presentation, and I am open for questions if there are any. But I will also like to leave this slide up. This is my email for if anyone has questions and would like to ask any questions.
Before we open up the questions, I'd just like to thank Ureni for sharing her time and this important information with us today. I also would like to thank those who joined the Lunch and Learn today. For anyone who would be interested, this recording should be up on the Family Partners YouTube channel by next week. Again, thank you to our presenter, and I will now open it up to questions.